Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Corky, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, heard every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we always encourage you to call in to join in. Today, well, I'm going to talk a little bit about thyroid. I mentioned it the other day, but because I'm like my own guest, then I always open it up for you and whatever's on your mind too. So let's say the two things we want to accomplish today. Say to you, hey, it's open phones. As always, you can call up and ask any question at all. Make any comment. The number to do so is 412-825-6262. I also want you to hang in there with me. I want to get a couple of new concepts across with respect to thyroid disease. There's a lot of folks sitting out there right now that I'm fearful are very miserable. They don't know why. In fact, they just think that's the way things are and have to be when they do not. Anyway, we're giving you a little quiz out there, folks. Get a pencil and paper and see how you do on the quiz when I give it to you. And maybe we can assess your thyroid over the airways today. So that's what I have in store. Hope you enjoy spending the time with us. And remember, that number, 412-825-6262. Now, really had an enjoyable time. Didn't you have an enjoyable time on Monday? We had Vera Watkins with us. And I tell you, that accent of hers, that Czechoslovakian accent, I thought I was talking to Ariana Huffington. I mentioned it. And she educated us, me for the first time. I'm guessing that many of you out there, especially the male listeners, it was also your first time of learning about what is lumped together and called compression wear, compression clothing. And we got quite a bit of information given to us. I want to tell you, as an addendum to that, I have received, I talked off air once the show was over. I talked off air with Vera to tell her, thank you so much for bringing us a new topic, one that clearly educated me a whole lot, and I need to be brought up to speed on it. So now I think I can communicate and discuss the issue, and I think the same thing holds true for you out there too. So I thanked her, and she said, you know what? Tell me about your size. I want to send you some wear, some compression wear. So I gave her a couple of the dimensions that she asked me about. Well, I'll tell you what. She overnighted that wear. I received my own compression, I guess we call it a top, okay? I haven't put it on yet. Okay, I wear surgical scrubs a lot, and this is not easily concealed. I mean, this obviously that I think I'd be asked some questions about it. But I do plan to put it on. Once I do, I'll report back to you how I feel, whether I have additional energy, and there were a whole bunch of other. What did she say? Oh, Vera. Try to look. Said energy improves. Oh, energy, health, and permanently reshapes the body. Well, I don't know how I'll favor in all those, but nonetheless, I thank her, and we'll bring her back sometime in the near future and see what she has new to report that she didn't give us last time. Now, I got to tell you something else too. I always receive calls from various pockets of publicists throughout the country because they contact me and they say, "Hey, I got this author or wrote a book or has this new idea, and would you like to bring them on the show?" Many of my guests, a lot of my guests, come from these various groups of publicists. And I just thought it was a bit of irony that here on Monday, after hitting the topic on compression wear for the first time, I get a phone. Now, this is true. This is absolutely true. You'll end up being able to follow me on this in the very near future as one of the up-and-coming guests comes on board. But I got a call from one of these publicist groups saying to me, look, Dr. Courtney, we have a great guest, just hit our circuit, and we think you'd like to have him. It's on, get a load of this, folks, it's on compression wear for animals. I think specifically dogs. And this was on Monday. This was right after we got done with Vera Watkins, and I thought I'd learned about compression wear for the only people that really needed to be concerned about compression wear, which were humans. And then a few hours later, I get a phone call saying, hey, you got to have this guest on your show because they promote something, and they use the word compression wear for animals. Now, it even has its own little colloquialism. It's called a thunder shirt, and we're going to be bringing that guest the first week in May on the show. But I just had to get to you and let you know how bizarre. I mean, in the same day, we get done with Vera Watkins talking about the human side of compression clothing. And I got a call within a few hours talking about an up-and-coming guest, and they'll be coming on board to talk to us about compression wear for dogs. You'll probably wonder, what the heck is that all about? You know what? I checked it out a little bit on the internet. There's a little bit of truth to the idea of why you might want to do that. And we'll just let it go at that for now. So I don't have a date inked. I gave them some dates. I said these are few first dates in May. So sometime in the beginning week of May, we're going to be learning more about compression wear, probably than you ever wanted to know. But a lot of animal lovers out there have problems. I didn't know that come the 4th of July, these animals, when the fireworks go up, they go through all sorts of anxiety and activity because they just can't handle it. And these thunder shirts supposed to calm them right down. Anyway, I've left enough out of the bag now. We'll wait until the guest comes aboard. In the meantime, however, additional guests that are going to come aboard with us are going to be on Monday. Rick Hill's coming back. Of course, he was the fellow 34 years ago. Was told at the Mayo Clinic, look, get your affairs in order because, well, things don't look good for you. You have testicular cancer, and there is no cure, and you aren't going to be with us too much longer. Well, it's now 34 years later. He shared some of that story with us when he was with us last, which was last Monday. Coming back again. Also, as I mentioned about environmentally contaminated air in your house, outside your house, and what to do about it. We're going to pick up on that, as well as with water purification when he returns with us next Monday, the 26th. On next Wednesday, a gentleman by the name of Mark Underwood. I don't have any of the stuff faxed to me yet, although I understand the topic. It's on OBS, organic brain syndrome, and he'll be with us on Wednesday. As soon as I get a little more information, I'll give you some information, too, to clear that up and remove all doubt. And then I see, as I've mentioned before, Dr. Eric Shapira, the writer of the book A New Wrinkle, what he learned from working with geriatric patients. He's a gerontologist, and he enlightened us last month, and we're bringing him back. So great lineup of guests coming up. You're always my most favorite guest, the impromptu guest, because you get to call up and we get to find out what's on your mind. You may call up today, 412-825-6262, anytime, and get it off your chest in terms of what's on your mind. You got to relieve that pressure. You got to get it out. You got to talk about it. So give us a call, 412-825-6262. Now, what I'll do is I'll take a short break. When we come back, I want to talk a bit about something that hit the newspapers. I mentioned this on Monday. On these infection rates. I don't know if you saw a huge article in the Post-Gazette. This hits a very familiar spot in my heart because back in 2005, when this all hit the scene, right here in Pennsylvania, we were the first, and at the time, the only state to even be talking about evaluating infection rates at our hospital. We spent a lot of time on this subject. Well, now here it is, 5 years later. What's happened? Is it good? Is it bad? Or is it difficult to tell? Well, I'll let you decide. We'll let you come back with us and talk a bit about it. Be back in a moment talking about hospital infection rates.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Have you been to the doctor lately? What's the big top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit the Spirit. The blessings of Fruit the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit the Spirit, a blessing for your good health. Fruit the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Hey, good morning, everybody. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you on this Wednesday version of the show. We've sort of opened it up today. I've got a couple things on my mind I'll be more than happy and plan to talk to you about. You may come up with something that you want to elaborate on yourself, ask a question about, and of course, we always want you to do so around here. So jot the number down, 412-825-6262. If you already have it on your mind, give us a call. If you don't even know yet, but something sort of triggers you to think, oh, I want to know some more about that, you can give us a call. As long as you got that number next to you, you're well armed and ready for the show today. I want to spend a moment talking about how I interpreted an article that was in the front page of the Pittsburgh Post-Gazette, talking about, well, the byline here were hospital infections, hard to gauge. Caught my eye, certainly. And this topic of hospital-acquired infections caught my attention a number of years ago, 2005. I didn't realize that 5 years had passed, but nonetheless, in 2005, this issue first hit the pages of, well, not just the Post-Gazette, newspapers all across the country, because Pennsylvania was a leader. It was the first state of all the states who started to become showing their concern about the incidence of hospital-acquired infections. So much so that they, through the use of a council called PHC4, that's Pennsylvania Health Cost Care Containment Council. Gotta get that word up. I'm just going to call them PHC4. These were the people that were mandated by the state to gather information on the 165 hospitals across the state to find out what the infection rates were in each of those hospitals based on 5 or 6 different categories of infections, whether that was due to urinary catheters, for instance, or central lines or ICU experiences. Anyway, the categories were spelled out for hospitals to report on. And I will say this much. I gained back then an appreciation for how the hospitals weren't too happy about it. Now, I say this for this reason. They are always, and should be, and for the most part do, exercise concern when infection rates in their hospitals go up, and they need to get to the bottom of it. There's a committee in every single hospital. The committee is called the Infection Control Committee. I have sat on that committee in a number of hospitals, and I will tell you, and as I told you back then, as long as the infection rates, at least this is how I reported it, this is how I remember it. We sat in the committee, and there was a report given by a member of the nursing staff who told us about what the infection rate experience was for the previous month. And so if, I'll tell you exactly how we looked at it, everybody and all the doctors who sat there on this committee, if it seemed to be in keeping with the hospital's experience for prior months and prior years, well, we looked at one another and said, well, hey, it's that basic infection rate that we'll all come to know and expect. And so nothing out of the ordinary, nothing was raised in the way of concern. But that all changed back in 2005. Because in 2005, this Pennsylvania Healthcare Cost Containment Council was going to be fixing to publish, and it ultimately did publish, the infection rates of all 165 hospitals. And I will say this much. The hospitals submitted it because it was the law. They were not happy with having sort of the emperor exposed, the curtain pulled back on the wizard, if you know what I mean, because these kinds of discussions occurred behind closed doors in committee session, and they didn't really get sunshine coming into those meeting rooms, and the public really didn't know, and they said, as one of their goals, this council said, and so we want to be able to publish what these infection rates are because we think they are completely out of line, and we want the public to be able to know where the hospitals that they frequent, how they fared, how well did they do with these infection rates, so that the public and the consumer can make decisions about what hospitals they're going to enter based on knowing what the likelihood might be for them to get a hospital-acquired infection. By the way, these are many times lethal infections. Certainly a lot of morbidity, if not mortality, associated with them. And to have all that exposure back in 2005, although all the hospitals participated because it was the law, they really, and I'm going to emphasize again, they really didn't like the fact that their personal information was out there for the public to see. And there was quite a bit of argument that went on behind the closed doors of these council meetings, and I felt that, boy, this is going to be a great thing for the consumer. They're going to win the day. They're going to be able to determine what hospitals they support, and the hospitals are going to have to make the grade, meet up to a new standard, or they're going to have difficulty in getting patients to come to them because patients are going to be able to read what the experience of these hospitals were. I think that's enough preliminary information. Well, here we are. It's 5 years later, and I got to tell you, what could be surmised to have occurred, I think, has occurred, because we get bylines that says hospital infections, they say, hard to gauge. Another byline, despite 5 years of data, the state still isn't sure about its progress in reducing these infections after 5 years of data. What has happened? Well, let's mention a couple of things. One, in Pennsylvania, that is, up until from 2005 to 2007, this Health Care Cost Containment Council maintained the stats. They released the stats, and every time they did, the hospitals, I'm going to tell you, they were fuming because they didn't like the idea. Yeah, some of the hospitals had a great turnaround in their infection rates. Other hospitals didn't. And they didn't like the fact, I tell you, that kind of dirty laundry was being aired for all to see. So, unbeknownst to me, because I really haven't tracked it, something changed in 2008 in Pennsylvania. Pennsylvania Health Care Cost Containment Council no longer was asked to maintain the statistics. Instead, the Public Health Department came in, and I believe that's where the change occurred, because I think the hospitals of Pennsylvania, in particular, really finally achieved what they had hoped to be able to achieve, which was all these statistics are very amorphous now. To give you an idea, individual hospitals don't have to report in as individual hospitals. If they are affiliate hospitals, if they're in a big group, I mean, can you imagine UPMC with all its hospitals? Or how about Allegheny West Penn with all its hospitals? They are allowed to submit the reports, as I read this, as a group of hospitals, not a single hospital. And in so doing, it muddies up the water. It makes it murky, so the results aren't easily penetrated to appreciate how an individual hospital does. And I think with that, the hospitals won the day. I think that's why, not just in Pennsylvania, but countrywide. But I have to say, Pennsylvania led the country for at least those 2 years, 2005, 6, and 7, because of the work of the Pennsylvania Health Care Cost Containment Council, who was on a mission to really give the consumers the information they want and they needed to make decisions. And then at the time, decisions were being made to enter hospitals based on that published data. But the feds got involved, and countrywide have mandated that data be submitted so that they can assess the countries, the hospitals in the country, and their infection rate issue. And you can imagine each state doesn't have the fervor or the Health Care Cost Containment Council that is really as interested as Pennsylvania's was. And so it's quite possible you could see where some other state that didn't treat it as with the attention that we did here in Pennsylvania. And so I think this quotation pretty much sums it up, although study after study demonstrated, this is reading right out of the article now, although study after study has demonstrated how infection rates can be significantly reduced. A report issued last week by the U.S. Health and Human Services Department to Congress declared that, and then here's the quotation, very little progress had been made in eliminating hospital-acquired infections. I believe that based on a couple of things, number one, how each state took the charge put to them by the federal government, and number two, how the hospitals across the country were able to finally dumb down the ability of agencies to inform the public. I never did think, and as I think you probably can guess, that the hospitals were thinking this was so wonderful to have their dirty laundry aired. And for 2 years at least, it was aired. It hit the papers. People had this as a discussion. We talked about it many times here on the show. And it became a front page item for quite some time. Well, you haven't heard about it much since 2008 because that Health Care Cost Containment Council no longer has much to do with it. It's the Pennsylvania Health Department, and once it got moved over to there, once the study got moved over to there, the anonymity and the amorphous nature that would cloud and murky the waters so as to pull the curtain back over top of the wizard and put the clothes on that emperor finally was reached, and the hospitals had a level of comfort once again. At least that's my opinion. I'm sticking to it, and you're going to have to be in charge, as I told you back in 2005. Excuse me. You're going to have to be in charge of your own self and family whenever you're admitted to hospitals. You're going to have to be asking the doctor, the internal medicine doctor, the family practice doctor, whoever it is that's managing your case, to put on the chart that you want people to be gloved or hand washed before they enter the room of your room or a member of your family's room. That is any member of the medical community, as well as anybody who's ancillary services, for instance, maintenance or dietary or a whole host of others. And so I'm going to sort of back off and not climb up on my high horse once again, but I got a feeling that we're going to be hearing less and less about these hospital infection rates as time goes on, because the Healthcare Cost Containment Council, which I really tip my hat to, did such a stellar job for those couple of years. They are now out of the equation, and so the hospitals are feeling a breath of air. They're relaxed, they're calm, because the dirty laundry doesn't have to be aired anymore, or at least it's made so amorphous that you can't figure out what your local hospital is doing. So as a consumer, you just get dumbed down, and you won't be able to have information to make the selection and the choices that you did for at least 2 years while the Cost Containment Council was at the helm. That's my story. I'm sticking to it. I hope you allow me my bit of ranting here to go on for a bit. I appreciate the message and why I brought it to you, and hopefully wear it in good health. Okay, let's take another short break. I'll climb down off of my high horse, I promise. I'm going to open it up to you, 412-825-6262. Anything on your mind is okay with me. Hey, we got a knock at the door. Come on in the store. Hello, welcome.
Good morning, Dr. Courtney.
Hey, it's Radioactive Rich. I know that voice anywhere.
Right, okay. Yes, one of the things people need to do is take a good probiotics every day.
I'll agree with you on that, certainly.
Right. And also, turn around and keep track of your pH. Make sure you're not, on the acid side.
The acid side, that is a la Dr. Miller.
Right.
Absolutely. By the way, you usually give us a report on Dr. Miller. How's our good friend? He's doing well?
He's doing pretty good there.
Glad to hear it.
Yes, he's pretty busy, of course.
Oh, yeah, I'm sure of it. Well, you pass on our best to him. We always like to hear from you. I haven't heard from you in a while. I'm glad you gave us a call this morning to weigh in.
Well, I've been pretty busy there, and like I said, of course, his base powder is the thing to use if you take it.
Well, I just found out it was last week that he's making the stuff now.
Oh, he's been, yes.
Oh, yeah, like he has an area in the office that he mixes the stuff up, because the other doctor who did it, what was his name? The doctor who died.
Dr. Myers.
Dr. Myers.
Oh, yeah.
Yeah, and he's the one that used to mix the stuff up, this base powder, so that you could manage your pH issues. By taking base powder, you could alkalinize yourself, and you could measure by dipstick in the urine. It was a great way to do it. But then it was difficult to get the base powder, so I guess Dr. Miller just took it on, and so now he's like the only source around that makes this stuff, and it's really good.
Right. And of course, that book that they wrote, The New Biology.
Yep, I have my own copy, sure.
Right, like I said, that too. And I know before Dr. Myers died, he used to have a website there. But of course, after his death, that website disappeared.
Well, I know that the reason that I had a call, I ultimately just called the office and to find out where to get the base powder, was because a patient who had been using it couldn't find the product anymore, okay?
Right.
So I go, well, if there's anybody that's going to know about this product, it's going to be Dr. Miller. Then came to find out that it's being made right there in the office.
Right, oh, yeah.
Yeah, so that's where to get it, if anybody's listening, and Dr. Miller certainly is the proper person to be making it, because the standards that he'll keep will make certain that that product and the integrity of it maintains high quality standards, and I support it 100%.
Right, and you know, we're very fortunate that we have one of the best chiropractors in the country right in our area.
He's the greatest. It's been a while, and I need to get back over to say hello and everybody in the staff, and I'll get a free day, and I'll be doing it in the near future. But thank you, Radioactive Rich.
Quite welcome. Take care.
Okay.
You too. Bye-bye.
All right. So that knock on the door was from an old friend talking about an even older friend, Dr. Bob Miller. All right, let's take that short break. When we return, you see we've opened them up, 412-825-6262. Anything on your mind is okay with me. I'm going to be talking about thyroid disease. Waiting for your knock. Be back in a moment.
Want to help your family eat healthier? Instead of learning to disguise tofu with Wondrous Way, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Hey, good morning, everybody. Welcome back once again to AM Impact on Your Health. Heard here in KHV 620 on Mondays, Wednesdays, and Thursdays between the hours of 8 and 9 o'clock. I'm Dr. Dennis Courtney with you each and every time we meet here on the dial at 620. And today, sort of have opened it up to you to allow you to come on into the store and ask a question, make a comment. Anything on your mind is okay with me. I've taken liberty to climb up on that high horse. I've worked my way back down on the Tierra Firma and allow you to come on in at any moment and set the agenda. We got a knocker on the door right now. Come on in the store. Hello and welcome aboard.
Hello, Dr. Courtney.
Hello.
Wanted to ask you mentioned in the past there, I just wanted to ask for what he's up to date on. The dental work that someone gets done, what are the precautions you should take as far as type of fillings and a little about that? Is there testing for the type of fillings and other false teeth you might get?
Good question. Sure. I would say a couple of things about getting the dental issues resolved. There are 3 dental issues. One of them, and you mentioned it, is what to do about mercury amalgam fillings. That's not good. They're not good because the mercury leaches out of them. You end up swallowing that stuff, or it permeates the mucosal membranes of the mouth and so forth. And once it gets into the system, it stays there. So especially for those who are ill and are trying to look for an answer as to why, if they got a lot of mercury fillings, it's quite likely that that mercury toxicity is playing a role. But there are 2 other issues that I mentioned. The second would be root canal teeth. because root canals are also definitely have a medical hazard associated with them. And then finally, previously extracted teeth, where a dentist has pulled it. Those are the three dental issues. Now, you asked questions about the first one. Geez, what do you do about that? Well, I'd say this much. If you are ill and you have come to the conclusion, as many patients ultimately on their own do, that you think the teeth may have something to do with it, the first thing you better do is not allow any dentist that hasn't been trained a la Hal Huggins and his protocol to remove those fillings. The day has now come where dentists can't look at patients with a straight face any longer and use mercury amalgam fillings. It's just too deadly a stuff. Too much information has hit the internet. It's been splattered about so much that the dentist really can't have a discussion about how wonderful and how safe amalgam is anymore. And so what you find as a result of it is they're more than willing to carve out the old fillings and put in the composite. I say that if you are ill, that would be a dangerous step to take, because without using a Huggins protocol on how to take those fillings out and how to remove them with the least amount of danger to you, and a person who hasn't been trained would more than likely expose you to the most mercury you're ever going to be exposed to at any one given day on the day that he does that. So that's the first answer to the question that you raised. I mean, how do you get these taken out? Who does it? Well, it has to be somebody trained in how to remove these teeth safely. Next, you asked, well, what do we put in the hole that the mercury amalgam was in? And there are plenty of composite materials that can be used. There are hundreds of them. In fact, I was quite startled when I learned how many different choices a dentist can choose from. The point is, and here's the question you asked, is there any testing that can be done in order to know which one of those is best for you? And the answer is you better believe it, because although those materials are a heck of a lot better than mercury, they can have individual consequences that are unique just to you. And they could cause a reaction from your immune system in you that wouldn't occur in somebody else. That can be tested for. The test kits, we have them here. We send those blood specimens out to Colorado, and we get a list back on what materials are safe and which ones aren't. And now that I answer your questions.
Yeah, so you have testing you do there as far as how compatible they are.
That's right. It's called compatibility testing, and it's a very specialized lab work, only done, I believe, in one lab in the country out in Colorado Springs. And whenever we have a patient that wants to have their mercury amalgams removed, we encourage them to get that testing done, because it helps the dentist select which materials to use and which ones to absolutely avoid, which are unique just to you. Could be safe. Those materials could be safe to somebody else, and because their testing could show there's no problem with that material in them. But it could be that that same material is a problem for you, and it can be known ahead of time, so why not know it? That's what I would say. Okay?
What do you need to give you to be tested? You take a blood test?
It's a blood test. It's a blood test.
Blood.
It's a blood test that gets sent on out to Colorado Springs. They then expose components of the blood to each of the hundreds of materials, and they're able to see under the microscope which ones have a reactivity that occurs, and those ones would be the ones to avoid. And then they see the one where there's little to no activity that is provoked by exposure to the blood, and then those are the ones that are okay. Okay?
Okay. Now, just putting a dam in the throat when they're...
rubber dam? Yes.
The rubber dam, when they're doing the drilling, that's not enough. There's more to the...
let's see. I'll give you a couple other things. Rubber dam is absolutely mandatory so that you don't swallow. In other words, you rinse the mouth out and you end up swallowing without the rubber dam being used. So you end up contaminating yourself with mercury, chunks of it, as a matter of fact, potentially, without the rubber dam. Number two, high-speed drill with high the use of water to flush the area with high-speed suction to clear it out. Those are the really, and you need a negative ion generator. How about that? Nobody does.
That's called?
Negative ion generator. That is a device that has two components to it, a thrower and a catcher. Little machines that plug in the wall, okay? And the thrower throws ions that are negatively charged from one side of the room across you to the other device, which catches those ions. You with me so far?
Yeah.
All right. Well, mercury that is generated by carving through the mercury fillings, the amalgam fillings, that is a positively charged ion. And so as they're released from the filling into your mouth cavity and into the atmosphere, this negative ion generator that is being thrown across you, the negative ions will glom onto and attract the positive mercury ion, which gets caught over on the other side of you by the receiving device. That is a pretty important tool, and I don't expect that unless you're Huggins trained, you would even know where to purchase such a tool, okay? So
Know about it.
if you just ask, hey, you got a negative ion generator here, and they say no, I think you got your answer as far as whether it's a Huggins trained person or not, okay?
Yeah. You said there was a third thing. What was that?
I did say there was a third thing.
I thought you did.
I mentioned, talking about the high-speed drill. Oh, there's one other thing that has to do with quadrants, okay? Whenever we had Huggins came to Pittsburgh, and he did his certified clinic right out of our office. My goodness, we had people from all over the world come because the great Hal Huggins was literally working with us to help them. But the what I'm trying to make here, sort of spaced it out. It'll come to me.
They do a quadrant at a time?
Oh, quadrants. Yeah, there's a rule. And the rule is that when it's done in an office setting, meaning that you're going to have to do it by appointments, you can only do, here's the rule I was working for, one quadrant at a time, that you can only spend 1 hour in the quadrant, and at the end of an hour, you got to stop, okay? And that's why you're set up for 4 different appointments. So another good rule to look for is after you ask the negative ion generator question, if you ask, okay, how long do you schedule these appointments for, and how many times we're going to do it? If they say, oh, we can do them all in one time, we could do it, then that's another
another red flag.
That's a big red flag that this is one of the dentists who now can no longer look you in the face and talk about how safe mercury is, who's decided that for economic purposes, he'll be more than happy to take out the old stuff, but that's a person that hasn't had the training to do it in the safest way possible. Now I think I've pulled back the curtain, revealed the wizard.
As far as extraction, you said there's a ligament they got to take out?
Yes, a ligament called the periodontal ligament that every dentist knows about, but then whenever he extracts a tooth, he never removes that ligament. That ligament connects every tooth to the bone that the tooth literally is adhered to. And whenever you extract a tooth, half of the time, that ligament stays adhered to the tooth and comes out. And there'll be no problem if that is what happens. But another 50% of the time, it stays adhered to the bone, stays in that hole, the hole grows shut, that ligament dies, is dead, and must rot right there, and that can form what's called a cavitation. These are, the word cavitation does not appear in any dental books in this country, anywhere. So here's another one, how about a third one? If you use the word cavitation on your dentist, and he says, what's a cavitation? get up from the chair and walk out, because you've certainly determined would be on the shadow of a doubt after it had no negative ion generators, after you didn't know about how to divide the time to work in quadrants up, and now the other issue about not being aware of what a cavitation is, because literally Huggins invented that word. That's his word. That's why the medical books and dental books don't have it. You've used the three big pluses to figure out whether you want to stay in the chair and let that dentist work on you or not. Fair enough?
Cavitation is a bad thing that happens if they don't remove the ligament, right?
That's right, because the bacteria that digest that ligament, and of course any dead tissue is going to be acted upon by bacteria. In this case, they're called anaerobic bacteria, because they function in a poor oxygen environment. And this bacteria will digest the ligament. Oh, yes, it really will. However, it doesn't stop just because the ligament ran out. It starts digesting other tissue, like gingival tissue, gum tissue, or the bone itself, and it forms a cavity that has its name called a cavitation. And when we've explored them and opened them up, my goodness, with the colors that you see, the putrid nature of the fluid found inside of a cavitation are quite memorable, certainly to me, and memorable to anyone who happens to be around looking at what you would hardly know. Not even by x-ray. You can't tell that there's a cavitation there. But lo and behold, when you go, pierce that bone, the mandible or the maxilla, you'll be able to find and encounter this space worth of literally pus is what it is. It's infectious material.
Does insurance cover your testing for the type of things that...
I'm probably going to, right off the bat, I don't know. Whenever we do the testing, we just have the patient arrange to pay for that testing with the lab itself. So we're not really involved, and I don't really know how that works out. I'm just going to say no. Okay, I'm going to guess no. That kind of testing is, because it's only done in one lab in the country, probably hasn't gained the acceptance to be covered by insurances. However, more and more, the insurance companies are, as time moves on, opening up their, I don't know if it's their heart or whether or not people are banging on the table and saying, I demand this be covered, but I'm a poor one to ask. I don't know. I'm just going to take a wild guess and say, no, don't expect insurances to cover that.
You know approximately what that costs?
I think it costs $150 to $200, somewhere in that range.
Okay.
Okay?
Thank you.
Now, you got all your questions answered now? Was it a good conversation for you as it was for me?
Yeah, I think so. You're pretty sure. I didn't know you were a dentist, but
I'm not. I'm not a dentist. I just play one on television. If you know what I mean.
Thanks a lot, Dr. Courtney.
All right, thank you.
Great show. Bye-bye.
Okay, glad you. Like I said, there was your Huggins primer all wrapped up for you in a 5-minute easy take home, and if you follow that real well, you'll be able to act in your own best interest when it comes to how to handle your dental issues. Which, hey, do you have any root canals? Do you have any mercury amalgam fillings? Have you had a tooth pulled? And are you sick and don't know why? Oh, could be. Could be. Hey, let's take another short break. See how this has gone along today. Very good. Maybe somebody else out there with a different question wants to call in. Got about 10 minutes to go. I don't think with 10 minutes I'm going to, I'll probably just start this thyroid stuff and finish it on Friday, but nonetheless, it has been opened up to you. 412-825-6262. Be back in a moment.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, M.D. is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in a formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Through the Spirit. The blessings of Through the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Through the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Through the Spirit, a blessing for your good health. Through the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Hey, good morning, everybody. Welcome back once again to AIM Impact on Your Health. Here on this Wednesday morning version of the show, we have opened it up for you to dial in today and get it off your chest because, you know, pressure builds up, but you got to get rid of it. 412-825-6262 is the number to do so. We got a couple of knocks on the door. Why don't we let them in the store? Hello and welcome aboard.
Hello?
Hello. All right.
Thanks for taking the call.
Sure.
This is the person that called a while ago about my brother having surgery. He's going to have on the rotator cuff. He had 4 torn muscles in the rotator cuff.
Okay.
And he's going to be having surgery tomorrow.
All right.
And just wanted to know, because they told him not to take any fish oil and so on. I guess my question, what to expect and what afterwards, and I don't know, and the anesthetic and all that. Is there any questions that he should be asking?
From a surgical viewpoint,
Yeah.
except in the most general terms, because I'm not a surgeon,
I know.
probably, what led to the recommendation of surgery is he had either ligaments or tendons that no longer were inserted where they needed to be inserted.
Right.
And the surgeon's got to go in and either sew the pieces of the tendon together or staple it back onto the bone so it can take hold once again. So best to ask the surgeon about what to expect. Now, on the other hand, not being a surgeon and not really being able to answer you how that goes, I am an anesthesiologist.
Okay.
So I can.
I know they will be before. They'll meet with them before, and during the whole time, I think they're supposed to be there.
Oh, okay. Yeah, they'll be there, all right. With the shoulder surgery, the only real way you can do it is a general anesthetic, and so they're going to, we use the word, let them go off to sleep for that time that it takes to do the surgery. They're going to be very vigilant over that time. But anesthesia has turned to becoming one of the most safe of all the specialties because of the monitoring that goes on. So I don't know if your brother has a bunch of health issues.
No, he does. He's allergic to penicillin.
All right, won't be a problem there. They'll know about that. And I'm glad to hear he doesn't have health issues because with each health issue you accrue, like heart and breathing and kidneys and the like, then there are issues, even in the safety of anesthesia that's done today, that creep into it. But if you're saying to me, hey, my brother's a completely healthy guy, he just has this shoulder problem, the minimal amount of anesthesia that's going to be required for this probably won't lead to anything at all. I say 99.999% of the time. Okay? So you can't do this by biting on a rag. You're going to have to do it with an anesthesiologist and an anesthetist there. But that team will work wonderfully with the surgeon. They've done this many times before, and they do have it down to a science, man. So rest assured that things are going to go well, okay?
And afterwards, as far as nutrition, medications and all that?
Well, the medications are one thing. You talking about his supplements?
Yeah.
Yeah, let them feel good about getting him out of the hospital. They get real spooked about things they don't understand, so they say don't take any fish oils and no vitamin K and remove all supplements. They just get carried away with it. You don't have in the hospital. They're not going to give them any of those because they don't even have them in the hospital formulary. So you wait till you get them home and resume them again.
Well, okay, but I mean, as far as pain medications and such afterwards, they put them on antibiotics or.
Well, they will certainly do that, and there is some discomfort associated with shoulder surgery, and they got the right medications within the hospital environment to take care of pain completely. So don't bite a bullet.
Okay.
If he's hurting, tell him. You just bring the buzzer. Tell the nurse, and you won't be hurting for too much longer. You need to have that pain alleviated, okay?
Okay, thank you so much.
You're welcome. Good
All right.
luck.
Bye.
Okay. Yeah, I hope that should go well for right nicely. Got another knock on the door. Come on, the store alone. Welcome in.
Dr. Courtney.
Yes.
I guess it's getting close to the end of the show.
Yeah, bongos will be coming up here in a minute.
Okay, maybe I can call you back on Friday then if I don't get this through. You were talking about teeth. I've had a problem with, I had a sensitive tooth. Dentist says it's not the tooth. I went to an ENT doctor. He says it's not the sinus. The dentist said the tooth goes real close to the sinus cavity. If it's a minor infection, is there any way to pick that up? Does it show up in your blood or?
Boy, I can tell you this, that any minor infection, the way I would detect it, and I have to do it all the time, by the way, because I see chronic infections that are always potentially a problem, namely in root canals and in previously extracted teeth. Thermograms. Thermograms to me are the most revealing because even the slightest degree of temperature difference, one that you could never appreciate yourself, they light up like Christmas tree on a thermogram. So that's one way to tell for sure. Okay?
I did have that done, and it didn't really show up too much.
All right. Well, then you got to figure that it has nothing to do with infection. It's neurological, not
okay, because the tooth
microbial.
had a filling in a metal one, and it had to be replaced. He put a.
Tell you what, you're going to have to call on Friday. We got bongos in the background. Okay, folks, there you have it. Look, I promise on Friday, to bring back that same pen and paper. We're going to get to thyroid issues. I was going to be talking about a way to take care of hypertension with a supplement. Absolutely. Until then, and thanks for being with me today, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.
AM Impact on Your Health by Dennis J. Courtney, MD, Director of Courtney Medical Center, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.